This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right. Well, good evening, everybody. So this was a medical minute on an interesting kind of study looking at the outcomes of traumatic brain injury patients. And, we see sometimes pretty bad head injured patients. And, I think a lot of us have a sense, oh man, this person looks pretty bad. They're probably going to do terrible. They're never going to, be independent again. So this was a trial that followed up to a year out, pretty significantly brain injured patients, and they broke them down into severe traumatic brain injury, which was a GCS of 3 to 8, so pretty bad. Usually those people are intubated. In this cohort, about a quarter of them, more than a quarter, had a craniotomy because their brain injury was so bad. They had a mortality rate that was pretty high, like 30% mortality rate. They were in the hospital for like 3 weeks. The moderate traumatic brain injury was a GCS of 9 to 12, so still, a real head injury. And they looked at how these patients did, and at a year out of the severe traumatic brain injury patients, the ones that survived, half of them were able to be kind of independent for at least 8 hours a day at a year. So pretty impressive. Of the moderate traumatic brain injury, 2/3 of them were able to be independent at 1 year. And then even for people who at 2 weeks after the initial injury were still in a vegetative state, a quarter of them were independent or, had a good outcome at 1 year. So, I think this is probably better than what I thought those patients would fare, with pretty severe traumatic brain injuries. So, maybe it makes us think, all right, not all is lost just because they have a bad head injury and we had to intubate them and their head CT looks bad. So, continue the good aggressive care that we give these patients, knowing that there's a chance they'll be, back to independence at some point. Any questions or comments? Thanks.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.